Midwives are often linked to the birthing process, providing prenatal and postpartum support to patients. And while that's certainly true of the profession, in this episode of Being Well, I'll sit down with Carle Health midwife Zoe Dew to learn even more about her role in women's health care.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle, with Health Alliance, is always at the forefront to help you thrive.
Thank you for joining us for this episode of Being Well. I'm your host, Lacey Spence, and today we are talking about all things midwifery. And for that, we've got a fabulous guest with us today. We have Zoe Dew joining us here from Carle. Zoe, welcome to Being Well.
Thanks for having me.
Of course, thanks for coming. And we love to let our viewers get to know our guests before we launch into the topic. So can you give us a little bit of background? How did you end up doing what you're doing?
So my background is, of course, in nursing. That's how midwives get their start. I got my interest and my passion for this by watching a documentary called The Business of Being Born, which came out when I was in college, pursuing something totally different. I learned about maternity care in the United States and how even though we live in this country where we have access to technology and quality care, we're not always taking good care of our patients, especially when it comes to women's health. So I took my interest and my passion for that, and I went to nursing school and then got my master's degree, and now I'm doing this.
And so how long have you been in this field?
I've been in women's health since 2015 when I graduated from nursing school, and I've been a midwife for a little over 2 years.
And so if somebody is unfamiliar with what a midwife is, what they do, can you give us kind of lay the groundwork? What do you do?
Yeah, so a midwife is essentially a nurse practitioner who specializes in women's health and can attend births. So we have advanced training, a master's degree. Some of my colleagues actually have a doctorate. And we provide women's health care. So definitely a lot of prenatal care and attending of births, but we also do woman visits, contraception, things like that.
Okay, so you have a wide variety of things that you do. In the birthing space, there's also a term called a doula. Is that different from what you do?
Yeah, it's different, but really important support role. So a doula provides emotional and physical support to the birthing person and their family. They often build a connection well before they come to labor and delivery, and often provide postpartum care, support for lactation if the person is breastfeeding, but they're not a clinical or medical role. My role is to, order lab tests, make sure that monitoring is appropriate, help the patient navigate medical decision making, and then catch the baby.
Catch the baby. That sounds like it could be a very joyous profession.
Yeah, there are a lot of really joyful moments, and there are hard days too, but having the opportunity to be present at a birth is amazing every single time. It never gets boring.
Yes, so I was looking in your bio a little bit, talking about the area that you serve and communities that you serve, and one of them came up that you also serve the Amish community. Can you talk about that?
Yeah, a couple of our midwives go down and serve the Amish community, specifically in Arthur. We have a location that's just for those folks who tend to want to be a little less, more low intervention, and meet them where they are, because transportation can be an issue as well. But it's important that all of the women in our community have access to high quality care.
Absolutely. So if I'm somebody who is having my first interaction with a midwife, or I don't even know where to begin as far as how do I seek your care? At what point would I need a midwife? Do I have to have a midwife?
So the choice to pick a midwife is always optional. I think it's a great choice. I think everyone should consider a midwife. If you are not pregnant and whether or not you hope to become pregnant, you can enter our care for all of your women's health needs. So like I said, we do PAPs, birth control, we do gender affirming care and menopause care. So really anything to do with the uterus, breast, hormones, we're happy to help. And all you have to do is call our office. You don't need a referral. Your insurance won't require that. You can make contact whenever you want. If you are pregnant and want prenatal care, you can also seek us out by just calling our office, self-referral. Usually we have you call about the time you find out that you're pregnant so we can start taking care of you and make an appointment for that first prenatal visit. That usually happens around 10 to 12 weeks of pregnancy.
And so if I'm somebody who already has an OBGYN, do you work with them or are you instead of?
Yes and no, and a little
Okay.
bit of both. The great thing about Carle is we have lots of layers of care.
Okay.
We are a tertiary facility. We have a high-risk NICU. We have a high-risk OB team, in addition to kind of traditional OB team, and then the midwives. Midwives are experts in normal birth and normal care. There is a pretty broad range of complications we can take care of, gestational diabetes, a little bit of high blood pressure, but we don't do things like take care of twins, etc. So if you come to our office and you have a few complications, we consult or collaborate with the OB or with the high-risk doctors called maternal fetal medicine. If you are low risk, we can keep you all to ourselves. And if you're really high risk, sometimes we have to pass off your care completely. If you're established with an OBGYN and you really like that provider, stay with that provider. That's awesome. We have some really excellent physicians at Carle. If you maybe want to try a different model and see what the midwifery office is all about, you just have to call.
And so if you all are handling everything before you get pregnant, once you're pregnant, I believe you talked about a little bit of postpartum care. What kind of services, what does that look like?
So we have recently increased the number of visits postpartum. It used to be, we have all these visits building up to the birth, this intense moment of birth, and then we'll see you in 6 weeks. Which is not great. So we started seeing people at 1 to 2 weeks and doing some follow-up there just to make sure mental health is going well, if they're choosing to breastfeed, that's going well, and we're addressing complications early. Support is really important to new parents, especially if a baby just came out of them. So we like to do that. We also do provide a little bit of lactation support, although Carle has a special lactation clinic that people can see that is full of experts who are lactation consultants that help with the bulk of that care.
So let's scoot back a little bit. So talking about those 6 weeks postpartum that oftentimes, it just feels kind of like a desert of care. It's just like, you're a new mom, you've got this thing you're just trying to keep alive, you're sleep deprived, your moods are everywhere. What type of encouragement or instruction are you helping to bridge in that gap?
That's such a great question. And I think you nailed it. It's such an intense, emotional, beautiful, stressful time. The first thing I always tell new parents is charge admission to see the baby. Not necessarily a ticket price, but your family and friends are going to ask, how can I help? What can I do? Tell them you can come mow my lawn, you can walk my dog, you can bring me a meal, you can come speak to me like an adult about something other than dirty diapers. Yeah. That's really helpful. I think it's also important to identify those sources of support before the baby gets here. We spend a lot of time building our Amazon registry and decorating our nursery and picking out baby names, which are important and joyful parts of having a baby. But having someone fill your freezer and figuring out who's going to take care of you when baby gets here is also really important. And it's a critical part of your care postpartum.
Yes, before you and I started the official interview, we were just kind of chatting just about all of the logistics of parenthood. And it's a lot for someone to try and tackle alone.
Absolutely. Identifying building your village before your baby gets here is really important. So sometimes that's friends and family who can help you out. It's other people who have similar gestational ages to you. It's tapping into the resources that we can give you in terms of like mental health, et cetera, from the midwife's office.
And so I have a stat here that you caught 44 babies in 2023.
I did.
And you're already like over the 25-ish mark?
Yeah, I'm creeping up on 30. And it's been an exciting and joyful year. Yeah, busy.
So what does a typical shift look like for you as somebody who's, maybe the water's broke and, things are happening?
Yeah, the best part about my job is that there is no typical shift.
Okay.
Some days I am busy start to finish. Some days it's a little more relaxed. But typically when a patient comes in, they're in labor, I say, yep, it's time to stay and have a baby. So we talk about what that looks like. Maybe getting IV access, if they need medication for pain, or some people need antibiotics, we talk about what that looks like. For our low-risk patients, we talk about the option for intermittent monitoring, which means not always being connected to monitors. We talk about moving around positions that will help facilitate maybe not an easy, but an easier birth. Pain management, whatever they want to do, whether it's epidural, nitrous, tub or shower, moving around, all those sorts of things.
So do you help if somebody is trying to come up with like a birth plan?
We can be a resource for that, for sure. I think a lot of the benefit of building a birth plan is doing that research behind the scenes and learning about the things that will be offered, and then coming to the midwives with questions, and we can talk to you about what your options are, what's available, what's safe, what's appropriate, what the evidence says, and we can build a plan that works for you.
And I know things don't always go to plan, you know, that's life. But if there's somebody who's in the delivery room and they have made certain decisions about their birth plan, and sometimes maybe communication falls through the cracks, are you able to help advocate for them?
Absolutely. The labor and delivery nurses at Carle are excellent, and they are our #1 patient advocates first, because sometimes I have more than one laboring patient, but the nurses are one-to-one.
Okay.
But absolutely, if something is going a little bit sideways and maybe we need to call the OB for backup, we're talking about an unplanned cesarean or another kind of birth intervention that maybe wasn't in their plan, the first thing I'm going to do is talk to them about it early. I'm going to explain it. I'm going to give them as much time as I can to make an informed decision, and then I'm going to help them navigate that process, even if I'm not the person who ends up delivering the baby.
Okay. So if I'm somebody who maybe is sitting at home and they're interested in going into the medical profession, you talked a little bit about your schooling, but what does it look like once you specialize, I guess?
Yeah, so becoming a certified nurse midwife is at least a master's program. So you have to have a bachelor's and be an RN to begin. And it's a 2 to 3 year, sometimes longer, depending on how you do it, program. And there'll be a lot of hands-on training in addition to the didactic sort of book learning piece. It takes a while, but it's worth it. And then the first couple of years of practice, you're really getting your feet underneath you.
Fair enough. So you will definitely get to see a lot.
Yes.
You've talked a little bit about the program at Carle, what you all do. Is there anything new with that? Anything down the works or down the pipe, coming down the pike?
Yeah, there's a couple of things I'm really excited about.
Okay.
One thing is the midwives are working on becoming size-friendly providers. We try to be that way anyway, but the idea of this designation is that we acknowledge that pregnancy can happen in all kinds of bodies, in all kinds of sizes. And instead of making people feel guilty or ashamed or uncomfortable, we provide respectful, evidence-based care with accurate information about risks and making sure that we're still providing holistic care to people in all bodies who walk into our office. So we're really excited about that. Another thing that we've recently resumed at Carle, which we started before COVID and have brought back, is a program called Centering Pregnancy. This is a different model of prenatal care. Instead of coming to your 20-minute visit with me, you come in a group setting with a group of 4 to 6 other pregnant people and their partners at a set visit schedule. And instead of 20 minutes, you get closer to 2 hours. The patient really takes ownership of their care. They're taking their own weight, they're taking their own blood pressure, they're writing down all of the measurements of baby and heart rate, things like that. And then instead of a little snippet of education, you get this big, broad expanse of education and the opportunity to build that village and find people who are going through the same experiences. And the patients who have done it universally love it. They think it's a wonderful model.
That sounds so exciting. So you could find somebody who's like, oh, you know, I'm only a neighborhood away. Like, we could meal share. We could, you know, have the same young man come mow our lawn or whatever it is. Yes,
precisely. And building those connections and just being heard and being seen in your pregnancy makes such a huge difference.
So if we could kind of dive into that class, I know it's kind of patient run, but what types of questions are they asking? Like, what kind of knowledge are they gleaning from each other?
So if you get a few pregnant people in the same room, they're going to have similar complaints about back pain and heartburn and things like that. And so if you don't bring it up in your visit, I can't help you with it. But you get some people talking and it's like, oh, you know what really made me feel better was when I got in the pool last week. Boy, that made my back feel better. And then someone will say, I thought you weren't allowed to swim when you were pregnant. And then the midwife can address sort of myth-busting kinds of things, and the patients can build collaborative solutions to the common complaints they're having. They can also help each other tap into those resources like you mentioned. Oh, I've got a neighborhood kid who mows my lawn. I'm sure he'd be happy to mow yours. Really reliable. So that's kind of the care that we're getting. We also have guest speakers come in, so someone from anesthesia will come talk to you about what to expect if you get an epidural. People from lactation come to kind of support that information and education piece. So it's just a really wonderful opportunity to get a lot of knowledge.
Mm-hmm. Well, what a relief that it seems that COVID is in the rearview mirror, just to be able to bring back such a wealth of knowledge, such a great resource. Since we have you here on the hot seat, you know, are there any other myths that you could help kind of debunk?
Well, one thing that even my family does not understand is that I do not deliver babies at home. There are midwives who do that, but the certified nurse midwives at Carle operate in the clinic and hospital setting.
Okay.
You can get an epidural if you choose a midwife. You can choose to be unmedicated if that works for you. So we do a wide range of things. It doesn't have to be low intervention, and we like to use the word crunchy. It doesn't have to be crunchy if you don't want it to be. That's a big one that I get. I'm not a witch doctor. I'm a medical professional.
No, absolutely. You hear the name midwife. Are there men in this profession?
Oh, yes. One of the very best midwives I've ever known was Ray Spooner. He passed away several years ago, but he was sort of an institution at Carle and one of just a really excellent certified nurse midwife, the classic version of the midwife. Midwife comes from the Old English with woman, so it is about being with and together. And I think that's the most important part of the job, is not just me ordering your tests and interpreting them for you. It's about me being with you on this journey. The journey of pregnancy, the journey of birth, the journey of, no thank you, I don't want to have a baby, I can go on that journey with you too. So it's the being with is the important part.
And I'm sure you see just a variety of, again, walks of life, preferences. What is maybe some of the more difficult cases that have come your way?
It's always difficult when a patient has a loss, especially for a really desired pregnancy, and walking someone through that process, like delivering the bad news and then telling them about what options look like, what the next steps are, is difficult, but it's gratifying because I can be someone who's there. And when I say call us anytime, I mean it. Our nurses and my colleagues will respond to your questions at all hours, whenever you need us. So it's difficult, but it's part of the process. Occasionally, a patient comes to us and they haven't been treated well, maybe at a different facility, somewhere farther away, and they haven't had this experience, and they're ready to fight for everything that they want, which is great self-advocacy, but I want to take that down. Yes, I'm ready to say yes to your reasonable requests, and I'm ready to explain why I'm recommending something. So bringing a patient out of that intense anxiety place and down to you're safe and comfortable here. Yeah. I'm going to take care of you and you're in charge. That's difficult, but again, also really gratifying.
You seem like you would absolutely be just a super calming presence.
Sometimes I try.
But I have to ask, is there ever a time where someone, when you have to do kind of talk them off the ledge, like the option was a little too much? What's kind of something that maybe people should avoid?
I don't think there's any one thing that you should never ever do, because everything is very patient specific. But if a patient has a request they want to decline certain recommended medications in labor, we have a long nuanced conversation. What's important to me is that the person in front of me understands the risks of accepting or declining any intervention that I'm offering. It's not my job to convince someone to do something they don't want to do.
Yeah.
It's my job to bring them information. And if they feel very adamant, I understand everything you're saying to me and I'm just not comfortable, then I say, okay. And that's it. Because the care is respectful. And again, it's not my job to coerce anyone. It's my job to provide information and support.
Fair enough. So if we pivot back to prenatal care, maybe you're not even considering being a parent. Kind of walk through what some of those conversations might be.
About avoiding pregnancy or planning a pregnancy?
I would say both. We're just trying to pick your brain on everything midwifery.
Sure. So I think a lot of my colleagues and I love to talk about contraception. And people think birth control, maybe they think the pill, but there is a wide range of options available and something for everybody. Mm-hmm. There are non-hormonal methods, barrier methods, which protect against sexually transmitted infections. There are a ton of what we call long-active reversible contraceptives. So if you want to go a long time without having a baby, or you're just not in a place to make that decision, I can hook you up and set you up for 3, 5, 8 years if you want to. There are lots of options, and I love to have those conversations and bring out my little demonstrations and my little, tools to show people, here's all the things we've got, and you pick from my menu here.
If somebody has complications with some of those longer term contraception options, is that something that you can help remove in office, or?
Absolutely, yeah. We place Nexplanons, which is the one that goes in the arm, and IUDs in our office. We can do that. We can also do that before you leave the hospital after your baby is born if you really don't want to have another baby right away. Great option. We do all of that stuff. And if we do hit a snag, like I said, we have excellent colleagues just a couple flights upstairs from us that can back us up if we hit anything unusual.
So speaking of the unusual, what is maybe the most memorable case that you've had? Do any stick out?
Well, not too long ago, I got to be the midwife when my niece was born. So that was really wonderful and exciting, and I've never been so nervous as a provider because I just wanted to do a really good job. Everything went really beautifully, and I had a colleague to support me through the whole thing, and it was wonderful. So that was my favorite midwifery memory for sure.
And I think you kind of hit on it earlier, but your services are covered by insurance, correct?
Absolutely, yeah. Just like a nurse practitioner is covered the same way a doctor is, if you have, especially if you have Health Alliance, but you have any of the local plans, you should be fully covered at Carle. You can always call your insurer and ask, and if you are out of network, we can usually tell you that when you call to get signed up and kind of avoid some of those surprise bills later.
And if I'm somebody who is looking to get in contact with your office, what's the best way to do so?
You can give us a phone call. 217-383-6434 is the Midwives department. You will talk to one of our excellent PSRs, patient service representatives, and they will tell you everything you need to know.
Now, we've still got a couple of minutes left, and just to kind of circle back, is there anything that we didn't quite talk about that is important that our viewers should know?
Oh, goodness. I want pregnant people to drink more water. And I also want people who are considering a pregnancy, it's great to do some preconception care. So if you're thinking about it, when you come to your annual Well Women's visit, let's talk about it. Let's talk about medications you're taking. Let's talk about your mental health and getting you in a good place before you add some extra stress to that. Let's make sure that we've talked about your family history and risks that might arise. So nothing is a surprise with the pregnancy other than whatever curveballs the pregnancy throws you.
And when you talk about mental health, I know you said you guys are just a call away, but do you have any sort of relationship or referral to mental health professionals if it's needed?
Yes, we can make referrals within and without of the Carle system. A few of the midwives, myself included, have special training called Postpartum Support International Perinatal Mental Health. So we have special training in prescribing and managing mental health in the pregnant population, which is really wonderful. Years back, we weren't prescribing any medications. Now we know that that is not best practice. There are many things that are safe and effective during pregnancy, and the mental health of mom is just as important as the physical well-being of the baby.
And we did talk about postpartum depression in our last season, but I do think it's a topic that is always worth shining a light on. Can you kind of talk about just this is normal. It's okay to have these feelings.
Yes, 1 in 4 people who has a baby will experience some amount of postpartum depression or anxiety. And the first thing I want you to do is tell me or tell your OBGYN that you're going through this. I cannot help you with something that you don't tell me about. There are lots of things we can do. Even if you don't feel comfortable starting a medication, we can recommend therapy, we can talk about lifestyle modifications, and I can also tell you this is normal. What you're doing is hard, and if it feels hard, it's because it is hard. You're probably doing way better than you think you are, and let's come up with some strategies that will make you feel better so you can be the best parent to your baby.
And strategies like that, what does that kind of look like in a practical sense?
Protected sleep is number one. So finding a way to increase the amount of sleep that you're getting, making sure the sleep you're getting is high quality. Sometimes people are so worried they can't rest, and we need to address that. Sometimes they don't have good partner support, and we need to address that as well. Time outdoors and exercise. It doesn't have to be crazy. You have a newborn, your body just went through something. But a brisk walk, a little bit of yoga, some time in the pool, all of those things can make a huge difference in your mental health. They're not expensive. You can find a way to do them with your newborn, with your other kids, and they can really help get you on the mend.
And do you advise differently for patients who maybe went through a C-section versus vaginal birth?
In terms of mental health, not necessarily, but in general.
Sorry, for on the physical side of things.
Yeah, so if a patient has a C-section, I don't perform a C-section, so they'll do their initial follow-up with the doctor who did that. And then we take it easy. You've been through a major abdominal surgery and somebody handed you a newborn to take care of. So giving yourself a little grace is step one. Gradually returning to activity, with the knowledge that your body has been through something is really important. But there's no reason to think that you cannot eventually return to your normal level of activity and regain normal function. And if you're finding that you're not, you need to let us know so we can put you in touch with people who can get you back to where you want to be.
Very great advice. We're under 30 seconds here. Final thoughts, final words for someone at home who's maybe wanting to seek a midwife?
Yeah, I think everyone should consider a midwife. We have a wide scope of practice. We are going to do shared decision making, really put you in the driver's seat of your care, and very few people come in our doors and decide not to come back. You'll like it here.
All right, well, Zoe Du, thank you so much for coming on Being Well. I sure appreciate it.
Yeah, thanks for having me.
Of course, and we thank our viewers for joining us for this episode. We hope you learned so much. I know I sure did, and we hope to see you next time.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.